Hi guys, it's me with the second part of what I'm covering this month of October, the ACL injuries, TT and style. So last week I shared with you guys with one of the orthopedic surgeons well known down in Denver, Colorado, down in Vail, what surgery is, the basic facts. So real quick, let's go over the facts about the ACL injury. We know for sure that they tend to be 70% of them non-contact, okay? Also, it's likely to happen more to women than men, and primarily it's because the hormonal that women tend to have create more laxity, more loosening on their ligaments, which is another topic for next week. Also, there's different approaches to fix an ACL, surgical and non-surgical, which Dr. Oster went over last week on the video I shared with you guys. And most importantly, like you hear me say here and there, everything starts from the ground up, okay? And that's more the anatomy and kinesiology that is a little bit too much for you guys, okay? Now, the reason I'm sharing with all this information with you guys is because I'm interested to find out good candidates for our training approach, TTN style, for ACLs and meniscus injury, okay? Those are kind of go hand in hand together. So the typical candidate that will work well with my training approach is people that are 6 weeks out longer, maybe a year, 2 years, and since they had their meniscus or their ACL done, and they're still having some level of pain or mental hesitation, meaning they don't feel comfortable putting weight or turning or actually doing activities, okay? Which means they have a desire to get back to normal, to get playing, to hiking, to skiing, to running a little bit, but mentally they don't feel strong enough or able enough to do it. Okay, so those are great people that I love to work with. How am I going to address it? What kind of things we will work on together if they decide to come and talk to me about it? It's primarily two things. One is the triangle. The TTN triangle primarily, as you guys already know, focus on mobility, core strength, and strength in general. Anywhere from 3 to 4 types of strength, meaning isometric, isokinetic, like with the machines or the free weights, and also the compound movement, complex movement, like a squat and push press sort of thing, okay? Mobility brings us back to the facts that everything starts from the ground up. The facts that the calf muscle inserts right next to the ACL and the meniscus, it means that we need to not only be flexible, but we're able to be mobile at that level, right between the ankle, foot, and the knee, but also at the hip. So I will work on their mobility. With that said, everything starts from the hub, right? From the core. So we need to work on core strength and core stability because we already know for facts that likely the injuries, 9 out of 10 of them come from a non-contact, okay? So you gotta be stable, you need to be strong so you don't go into that or cause that injury, okay? And lastly, of course, strengthening the muscles around the knee and below the knee, okay? So the inside of the muscle, the inner thighs, the outside, the hips, everything, okay? And then the last piece of our training approach, TTN style, is what I call the BRAD acronym, which means we're gonna work on your balancing your muscles, hamstrings to quads, butt, GM to gluteus medius and minimus. So we create a balance. We're going to work on your reaction. Because how do you react? Because your foot stays and you turn, that tends to be a meniscus injury versus an ACL or a PCL. That's when there's no contact. Nobody hit you. Nobody did anything to you. You just kind of didn't react properly to whatever the stimulation was. Slippery ice, wet road, with the wet weather coming up, that slicky wood floor on the deck. Also accelerating when you go fast, and then opposite to it, deceleration. So can you go fast and slow down, or can you take off pretty fast and then slow down? So either go fast from the get-go at the beginning or stop your way down the hill. So these are the two big approaches that I use for any of my knee people, meniscus, ACL, PCL. So if you know of anybody that is 6-week post, which means their swelling is pretty much gone, but they're still having difficulties of some level of pain, going down the stairs, getting down to squat in front of the other tires or in their covers or whatnot, they'll be great candidate. But more importantly, they have a desire to get back to an active lifestyle. We should not be limited by an injury like an ACL or meniscus to slow down our lifestyle. Okay, that's all I got on ACL and knee injuries that I would like to share with you guys this month. Okay, with any other question, just call me, email me, and share my information. Okay, that was all about sharing the knowledge. Talk to you guys later.